Mhm.
Okay, super.
Good morning, everybody. It's Thursday morning, so you know what time it is. What time is it?
It's Ask Dr. Andy.
Oh, what time is it, though?
It's the morning. It's 9 o'clock, I think.
He's so Pacific. You're Pacific.
I can be more vague if you'd like me to.
All the comments and statements by Eddie Buffalo and Dr. Andy are purely for entertainment purposes. Check this out.
Yeah. Let's go. Woke up not feeling great. Gotta go see my doc today. I wonder where they go when they are sick. Do they act like babies? Try to self-diagnose. As long as they don't look on the interpersonal. Gotta go see my doc today. Gotta go see my doc today. That's the hardest thing to do, but we all do it anyways. Is it just me in the room? In the room, trying to call it early, trying to know too soon. Do they act like babies? Or try to self-diagnose? As long as they don't look on the interpersonal. Gotta go see my doc today. Gotta go see my doc today. Oh, it's the hardest thing to do, but we all do it anyways. What do you think when your body starts talking back? Do you trust the signs or make a story fast? Gotta go see my doc today. Gotta go see my doc today. Oh, that's the hardest thing to do, but we all do it anyways.
I hope everybody liked that. Get a little funkified this morning. I do want to make an announcement. Dr. Andy, this will be the last Dr. Andy show because I can't afford co-pays. It keeps on charging when he comes in every time. I'm like, son of a gun, Blue Cross and Blue Shield don't pay for it.
Yeah,
Bastards.
well, we have to collect copays, actually. You can't defer a copay by most of the insurance rules. You have to collect it. You can't tell somebody, put it on the side.
I'm a poor fella from South Buffalo. I can't afford those co-pays anymore.
Well, I know somebody for you. Me.
So we're going to get started. Before we get started, though, we're going to talk about one of our favorite sponsors and doctors like this, and it is our friends at Pins and Aces, pinsandaces.com. I'll let Andy tell you all about Pins and Aces, and I'll try to go on different pages, whatever.
They make a lot of golfing equipment, and to my point, they make some of the nicest. They make some of the nicest golf-related clothing. They make comfortable, tasteful, pleasant clothing you can wear either on the links or you can wear on the street. And they also make a golf cart with a built-in tap, not for me, but for Ed.
Oh, no. not for me either.
Okay.
So if you want to look like Rodney Dangerfield in Caddyshack, you can't.
I don't think they make anything that loud or tasteless. No, they make really cool hats, apparel. They make nice golf bags. They make all the things you need. Covers for the golfing head.
Hey, you get a free bowl of soup with that hat. It looks good on you.
Yeah.
So check out our friends at pinsandaces.com. When you check out in your shopping cart, put in the code Buffalo and you will get 21% off.
And they have additional discounts on
yes,
some
a lot of
materials.
times they have mystery ones. Yeah. And by the way, if you see something that you like, especially if you're a large or an extra large, buy it when you see it because it's probably going to be gone the next time you see it. They sell out all the time. So how are you today, Dr. Andy?
I'm very well. What I wanted to talk about is what really goes through your doc's mind. And the first thing that someone made a good point, who do doctors go to when they're sick?
Mm-hmm.
Ethically, there's a lot of rules about that. You can't treat yourself. It is not ethically okay.
But you got to go to a vet?
Well, me, yes. But most physicians have to go see another physician to get treated. And for what it's worth, that's a good thing.
Are you up to date on your rabies?
Yes, I am. And I've had my tetanus shot and I've been warm.
Oh, thank God. Just don't bite me. All right. We'll just keep it like that.
It's tempting, but we'll walk away from it.
Now, what's worse, Andy, when someone tries to self-diagnose or they go on the interweb and look stuff up?
I don't like to say don't be an informed patient, but I would urge people, if they do that, take it with a grain of salt. You don't really have the basis of comparison. You don't have perspective. And a lot of times what you're reading is not accurate. Everything in the internet is not set in stone.
Well, you brought up a good point, because what they are saying now, that when they build AI agents to interact with the public, they're yes men. So not saying they're lying, but they're going to try to tell you the answer they think you want, which might not be the true answer.
There I'm out of my depth. I can say that a lot of people have gotten a big fear by going on the internet and putting things in and getting a big laundry list of possible diagnoses, some of which are very, very critical, and not having perspective.
So what I want to ask you,
Sure.
when somebody comes in
Mhm.
and they have a laundry list of stuff, you know, oh, my back hurts, my toe hurts, my hair hurts, I got a runny nose, I got a runny ass.
Okay, sure. There's a good ethical approach, and this is what I personally will do. First of all, I make it a point to have reviewed your chart before I see you and have perspective. What are your major pathologies? What's life-threatening? What is going to either lessen the quantity or quality of your life?
So
And
do you prioritize it then?
Yes.
Okay.
You hit it right on the nose. As usual, you're right on target. Mine's bigger. What I do is I already have a laundry list of what I think needs to be done promptly and reasonably promptly. And when the person comes in with their laundry list, we reach an agreement, because you can usually only address 1, 2, possibly 3 things accurately during a visit and get results. So I try to help that person risk stratify, pick the things that are most important. I will try to hit if something is particularly aggravating to the person, but I put it in perspective. Let's not, rearrange the deck furniture on the Titanic. Let's patch that big hole in the boat. Most people will do that. What I'll do is I'll suggest, when they come in with their 30 complaints, it'd be like getting in a fight with 6 tough bikers. You would not wade into all 6 at once. You would lure them out one at a time and deal with them.
Like eating an elephant. How do you eat an elephant, Dr. Andy?
Typically, fork and spoon and a knife.
One bite at a time.
Yes. And most people will respond to logic. Most people want to take good care of themselves. And if you help prioritize things and you offer them the idea that if you have 7 problems and you throw at all 7, 6 months from now, you're going to have the same 7 problems on the list. Let's pick 2 and knock them off and get that list down to 5.
Now, here's something that I want to ask you about.
Yeah.
Okay, and prostate cancer. Okay.
Yeah.
I didn't realize that your junk's not going to work after you have your prostate removed.
Not necessarily so.
So
Not
explain that a little bit
necessarily
more.
so.
And if someone's upset about what you're telling them, what is your best way of talking them off the ledge?
Okay, first off, with prostate cancer itself, they try to do nerve-sparing surgeries. They do make it a super high priority because you want to retain your ability to hold your urine and, of course, to have marital relations.
You gotta be married to have sex?
Well,
That's what I'm doing wrong.
it keeps me safe.
You never make me use protection.
Help. Meantime, how do you talk people off of ledges?
Yes, I would like to know that.
Let them say what they think is going on. Let them give you their understanding of what is going on. Give them a perspective of what your understanding is, from an evidence-based standpoint. Give them good, straight evidence what the process involves. Hear them out, what they think is going on, and try to help get them back onto a more evidence-based track. Ask people what they're afraid of.
And I'm sure you get some off the wall things, and I'm not going to ask you to tell us, but I'm going to throw some stuff at you that I think is
I'll
off
give
the
it
walls.
a try.
I got a mosquito bite. I think I got malaria.
Okay, well, I'll sit down and tell the person malaria is not endemic to this area, or it is, or these would be the things we look for. They're not there. I just try to tell the person from an evidence-based standpoint where their logic is good and where it may be getting a little bit off track.
Well, I'm going to paint a picture for you, okay? So at one point, I was a very large man, and I wanted the bariatric surgery. And I didn't get to that point until my doctor called me something. And to this day, it still sticks in my head. And I think this was the reason that I got it done. And he called me morbidly obese.
Okay.
And why don't you break that down? And do you use that word when you're talking to people that are overweight?
I will start with, I try to be as gentle as possible. I'll try to go more what the consequences of the problem are. And if it has a name that has a lot of emotional baggage with it, I'll qualify it and I'll say, hey, this word has a lot of emotional baggage. The term that is usually used is whatever it may be. Okay. I try to unpack it, tell them more from a consequence standpoint.
Now, obviously, you're not weighing people. You're probably rechecking blood pressures and things like that.
Yes.
What if I'm a lady and I don't want to tell you how much I weigh? I don't even want to get weighed. What do you think about that? I'm going to tell you your damn business.
Okay, that's your privilege.
I run into this in the insurance world. That's why I'm asking.
You're absolutely allowed. It's your privilege to decline a test.
Up. We have a call. Let's see who it is. Good morning, caller. You are on with Ask Dr. Andy. How can I help you?
Hey.
I'd like to ask Dr. Andy.
Hey, how are you?
First of all, before you knuckleheads start talking, all the comments and statements of Donnie Lowe are purely for entertainment purposes. I told you can't ask them if you can hang from a bar to grow yourself, Don. You're not growing anymore, buddy.
It'll stretch me a little bit at least.
Well, actually,
handle this patient.
Actually, you will decompress your spine a small but not super significant amount. But as soon as you're back on your feet, you're going to resume the size you were fairly rapidly.
Okay, so I'm a young man and I'm bringing my elderly father, Donnie Lowe, to you.
Ooh.
And do you let me be in the same room?
That's up to the patient. That is the patient's call.
You want me to stay in the room, Dad?
It depends on what we're seeing.
He loves seeing it. Depends. Are you calling about your drippy thing because you got another STD because you've been messing around in the nursing home?
Oh, God.
Oh my goodness. Maybe I'm sorry I called.
Do you want me to leave the room now?
Take the
All right, so I'm done. I'm done being a wise guy.
I don't have that option. I've got to stay in the room.
That's right. Yeah,
Yes, I do.
you're out of luck. Okay, go away. Go ahead. Go away. No, go ahead with your answer. Go away.
Freudian slip.
Yes. The floor is yours, Mr. Lowe.
I just wanted to call and say hello, see how everybody's doing, and what is the topic for today?
What logic goes through a doctor's mind when he comes into the office to see a patient? What am I thinking? What is my strategy? How do I base my strategy? Why do I do what I do?
Well, there's a lot there. That's a lot.
I kind of got the idea for the show when we were doing one of our Buffalo Fight show, and with Andy, he was a ring doctor at one time, and it really took me aback when I said, "Well, what are you thinking about?" And you said you were worrying about what this person's face is going to look like 10 years from now.
Yeah, or is the person's brain going to be working? Are they going to be alive? I try to look at the 10,000-foot view of what's going on along with the near view.
I think that's what should be done, right? From a standpoint of physician to patient.
Yeah.
From my standpoint, yes. I try to look at where are you going to be in 5 years? Where are you going to be in 10 years?
Dead.
Are you going to regret this decision up the road? Because I'm there as your advisor. I'm not there as a parent. I cannot tell you what to do. I can give you advice. I can give you the relative risks of actions.
So ask him that question you want to ask, Dad.
Well, I guess it's not like anything specific to me, but I'm thinking.
It's about him. It's about him.
I've got a friend who's got a.
I got a friend that it's Donnie. He knows a guy.
He has no friends.
He knows a guy that's got a problem.
Speak for a friend. No, but I don't know if there's a percentage breakdown or not, but when you offer your advice and you're thinking, well, this, you can feel better in 2 years down the road if you do this, this, and this. And the patient says, no, I need to feel better now.
Well, we have to be a little more specific. We have to be a little more specific there.
What's your problem? We got to fix, Don. That's what he wants to know.
May I?
Yeah, no, I'm just saying, like, if somebody has what they think is just an acute pain, say in their back, but you're saying, well, it's going to take 6 months or a year of physical therapy or whatever the case might be. And they're saying, no, what can you do for me now to get me out of this agony?
Well,
do you run across that a lot?
Yes. And what I'll do is I use the facts. I will tell people this is not something that will get better rapidly. This is the time scale. This is the way to approach it. These are my options. I would never do anything to hurt a patient just because they request it.
Now here's a question for you. When you are diagnosing someone, you've been a physician for quite a long time. Are you basing your findings on fact or your experience or both?
All of the above. I use the science, what I have in terms of hard facts in front of me, what I know experientially, and I meld them. And I'll tell the person, if I'm making an educated guess, I will say, the choices are A, B, and C. It appears to be this because of that. I'll tell them my logic, and I'll tell them what my plan is and what my likelihood of success is.
Now, my question is there a difference from when you were originally starting out as a doctor, experience wise, that something has changed your mind about treating a certain thing?
Oh, certainly.
Like what? Give us a quick
Okay,
example.
with heart failure, when I first began as a resident and early in my career as a attending, heart failure was never treated with a category of medications called beta blockers. If you suggested that, you'd be sent to, I used to joke, you'd go to resident or doctor jail because you just did not do that.
And why is that, Andy? What is a beta blocker? first
Beta
of all?
blockers are medicine that slows down your heart, does a couple other things. I don't want to go off into the weeds,
Mhm.
but it was thought at that time to be harmful with heart failure. A
That's
company
interesting.
sat down and made a different kind of a beta blocker that actually is tremendously beneficial for heart failure. They proved it in trials, they proved it in the literature. I had to change my thinking. Good example?
Mhm. Yeah, I thought it was really good. What flavor of beta blockers are there?
Vanilla, chocolate, and strawberry
Oh, no Tutti Frutti?
coming next year.
So Don, as you are a pickleball player, a pro pickleball player, what nagging injuries have you had, if at all any? Because I know you are in tip-top shape.
Spouses are not nagging injuries.
Oh, wow. Oh, you better sleep with one eye open tonight, buddy boy. As the Williamsville Mafia comes and gets you.
I'm gonna tell your line, Eddie. So, table for one. So,
Tall, Dr. Andy, table of one. Your table's ready, sir.
I'm sorry. Now you're talking about things that nag you with regard to your racquetball career.
Right now, you changed it to racquetball. Nobody wants to say you're a tennis player. What's that saying? That I think there's something going on with that, Don.
saying that I'm not a good tennis player. That's all.
I have no idea.
Oh, by the way, I get all these crazy movies on my cheater. And what did I call you about a movie with Chris Farley's brother, Kevin Farley? What was the name of that movie, Don? It was about pickleball teams at a community center. It was the worst piece of crap I ever saw in my life, and I still watched the whole damn thing.
Could they get Chris Farley's brother and John Belushi's brother just
for shits and giggles? Maybe.
For substitutes.
Maybe.
The generic.
Now, I have a question for you. If you have never seen me before and you end up giving me a medication and I have an adverse reaction to it, I'm like, screw this guy. I'm not going back to him. How do you handle something like that?
I ask what your concerns are, and if it's something that I did that's not to standard, I'm very upfront and say I'm sorry.
Because you're human, you know.
Profoundly human.
Mm-hmm. You're not robot.
No, I'm
Domo arigato, Andy Roboto. Domo.
No,
Domo.
if I make a mistake, I'll fess up and say I'm sorry. If there's something I don't know, I'll tell somebody I do not know, and I will find out.
Now, there's a big problem in this country where older folks are drug seeking, not to take them, to sell them. Now, what do you look for signs that you've seen that you think this person is drug seeking?
There are numerous signs. First of all, most use of narcotics is inappropriate. It's very rare that narcotics are the drug of choice for something. People who have sickle cell disease, people who've got cancer, people who've had an acute trauma, yes, you do need to have, potent pain medicine. Absolutely.
It's very important.
However, we have an authority.
It's very important. Wow. Salt, table of one for sure. Donnie and Dr. Andy.
Well, it's just if you put your neck there on the table, I'm gonna. No, people who are requesting medications by name, people who are requesting medications for inappropriate uses, people who go through the medicine more rapidly than it's prescribed, people who do their urine tests and they don't have the medicine in their urine.
Now, I have a question for you, and you don't, if you're uncomfortable answering it, don't. but parents that bring in children, and is that Munchausen's where they're trying to
Munchausen by proxy.
talk a little bit about that, and how do you know? I mean, after all years' experience, what are the signs that you see that these people are keeping their kids sick?
That's a very difficult diagnosis to make, and the way you know is very individual to what's going on.
Mm-hmm.
Typically, you're going to find things that don't match.
Like, give us an example.
It depends what illness is going on. I'm not trying to be difficult. There's not one magic test.
Don,
No,
take care
it
of
is
it for me.
difficult.
Now, I come to you and I tell you these off the wall stuff. There's little people that come and see me at night, and I think they're the ones that are causing my pain and my injuries. What can we do about that? This is, I mean, psychiatric things have to be tough.
That's absolutely not consistent with reality.
Mhm.
I will tell them what you're telling me is not consistent with reality, and then we'll explore where their belief comes from, where mine comes from, and I'll tell them if their thinking is somewhat divergent from.
Mm-hmm. Now, how about when an elderly person comes to you
Mhm.
and their children are trying to talk them into going to assisted living?
Mhm.
That's got to be a very difficult conversation to have with someone. And do you talk more to the patient or to the daughter or son or the whole family?
Well, if number one, as long as you're somewhat competent and cogent, you're in charge of your health care. You can refuse things even to the point
That's
of it
interesting.
being to your detriment. Number two, you can choose who's involved in your health care. As long as you're competent, you can say, I really don't want my family's opinion on this.
So those papers Donnie sent me that he wants me to go into a home that shouldn't have been done because I'm okay. I can make up my mind. All right. Well, most of the time I can make up my mind.
We're going to do some.
Hello, Donnie, are you here?
We'll do some cognitive testing later.
I hear you, Donnie. I don't see you. Where'd you go? That's got to be very hard.
You just have to sit down and make people aware that the patient's rights are the number one thing. You know, patients are allowed to make decisions. When I have patients who are making decisions that are unrealistic, I'll start and ask them, I'll say, where do you think you're going to be in 5 years? Where do you see yourself in 5 years? What would be your desire? What do you think is reality? And let them tell me. And then we explore it and we unpack those things until we find a middle ground.
And what were you going to ask, Tom?
Well, what I was going to say is one of the things that we do, Dr. Andy, when we sit down with the client, and say it's an initial meeting, there's a lot of questions that we ask, and it's not to be nosy, but one of the questions
That's
that we
very
ask
difficult.
is if they have a healthcare proxy. So is there somebody that they trust that can make healthcare decisions for them should they become unable to do so?
Yeah.
Down the road?
One thing I try to do as early on as I can while people are well is establish what their healthcare wants and desires are for resuscitation and other things like that, and who they would want to help make decisions for them if they're unable to, while they're well, competent, cognizant, and they're not making the decision under any kind of duress.
That one of the toughest probably got to be, hey, Dad shouldn't be driving, Andy. Can you talk to him for me, Dr. Andy?
Well, I've done that many times.
That's got to be very hard.
It's more difficult for the patient than it is for anybody.
They don't want to give up their freedom. I get that.
Well, they feel like they're having their adulthood taken away from them. They feel like they're losing their agency as an adult.
I never became an adult, so I should be okay, right?
That explains the learner's permit.
Learning and learning and learning. That's all I do. Well, listen,
right.
I hope that this opened up your eyes, folks, to some different things. And don't take anything that we are saying as Bible. If you have questions medically, seek a professional.
Yep.
You know, because all the comments and statements by Eddie Buffalo, Dr. Andy, and Donnie Lowe are purely for entertainment purposes. But I hope we opened up your minds and your eyes to different things and different rights you have as a patient. And he's still a guy at the end of the day.
Yes. And
You know?
I'm human. I make mistakes. I will fess up if I make a mistake. I try to work with people.
So what we're going to do right now, we're going to end the show like we end every other show. If you like working with people that are just like you, have the same values, have the same passion for life, and love your children as much as we do ours, we're the people to talk to. You can reach us at ebifamily.org. You can also send us an email to Eddie Buffalo at ebifamily.org or Donnie Lowe at ebifamily.org. I don't know if you used your email yet.
I know I've not set it up yet.
Okay,
You
good.
know me.
Yes. And what's the hotline, Donnie?
903-412-1554.
And Dr. Andy,
412-1554.
and Dr. Andy, for our friends on the planet Mars, what's the number for them?
Still 903-412-1554. I just didn't know if there was a second language there.
So remember, guys, life is definitely worth living. What do we got to do, gentlemen?
Just keep fighting.
Just keep on fighting. Have a great day, everyone. Take care now.
Ciao, ciao.